Hello everyone, welcome back to Inner Power Psychiatry. Today, we're discussing a critical topic that affects millions of people worldwide, eating disorders. In this video, we'll cover the different types of eating disorders, their characteristics, symptoms, and health risks, and we'll also talk about the importance of seeking help. Let's get started. First, let's define what eating disorders are. Eating disorders are serious mental health conditions characterized by unhealthy eating habits that can negatively impact a person's physical and emotional health. Around 9% of the U.S. population, equivalent to approximately 28.8 million Americans, will experience an eating disorder during their lifetime. Although eating disorders are more frequently diagnosed in women, men are also significantly affected, comprising up to 25% of those with eating disorders. One of the most well-known eating disorders is anorexia nervosa. This condition is characterized by extreme restriction of food intake, leading to significantly low body weight. People with anorexia have an intense fear of gaining weight and a distorted body image. Symptoms include severe calorie restriction, excessive weight loss, preoccupation with food and dieting, and denial of the seriousness of low body weight. The health risks are severe and include malnutrition, heart issues, osteoporosis, amenorrhea, and potential multi-organ failure. Next, let's talk about bulimia nervosa. This disorder involves recurrent episodes of binge eating, followed by compensatory behaviors like vomiting, excessive exercise, or the use of laxatives to prevent weight gain. Symptoms include eating large amounts of food in a short period, feelings of lack of control during binge episodes, frequent trips to the bathroom after meals, and signs of purging like calluses on knuckles and dental erosion. Health risks associated with bulimia include electrolyte imbalance, gastrointestinal problems, dental issues, and heart complications. Another common eating disorder is binge eating disorder. This condition is characterized by recurrent episodes of eating large quantities of food, often quickly and to the point of discomfort, without subsequent purging behaviors. Symptoms include eating when not physically hungry, eating alone due to embarrassment, and feelings of guilt or shame about eating habits, leading to distress regarding binge eating. Health risks include obesity, diabetes, cardiovascular disease, and high blood pressure. Now, let's delve into the biological factors behind eating disorders. By understanding these elements, we can better appreciate the complexities of these conditions and the necessity for comprehensive treatment approaches. We'll explore genetic predisposition, neurobiological mechanisms, and hormonal influences. First, let's talk about genetic predisposition. Research shows that eating disorders can run in families, indicating a strong genetic component. Twin studies suggest that 50 to 80% of the risk for developing an eating disorder is genetic. Specific genes, such as the serotonin transporter gene and the brain-derived neurotrophic factor gene, have been linked to eating disorders due to their roles in regulating appetite, mood, and reward pathways. Next, let's discuss neurobiological mechanisms. Imaging studies have revealed differences in brain structure and function in individuals with eating disorders. For example, abnormalities in the hypothalamus, which controls hunger and satiety, have been observed. Additionally, altered activity in brain regions involved in reward processing and impulse control, like the prefrontal cortex and amygdala, has been noted. Neurotransmitter imbalances also play a key role. Serotonin, dopamine, and norepinephrine are particularly important. Serotonin is linked to mood regulation and appetite control, while dopamine is associated with reward and pleasure. These imbalances can significantly affect eating behaviors and emotional responses. Finally, let's look at hormonal influences. Hormones such as leptin and ghrelin are crucial for regulating hunger and energy balance. Leptin, produced by fat cells, signals fullness, while ghrelin, produced in the stomach, stimulates appetite. Individuals with eating disorders often show dysregulation in these hormonal signals, leading to abnormal eating patterns. Elevated levels of cortisol, a stress hormone, are also linked to eating disorders. Chronic stress and high cortisol levels can impact appetite and metabolism, worsening disordered eating behaviors. Now, let's explore the treatments for eating disorders. The approaches for treating anorexia nervosa and bulimia nervosa can vary. Let's start with anorexia. Anorexia nervosa is a serious eating disorder characterized by extreme restriction of food intake, leading to significantly low body weight. Individuals with anorexia have an intense fear of gaining weight and a distorted body image. This condition requires comprehensive medical treatment due to its severe physical and psychological impacts. In severe cases of anorexia nervosa, medical stabilization is necessary. This often involves hospitalization to address acute health issues such as severe malnutrition, electrolyte imbalances, or heart problems. Hospitalization provides a controlled environment where immediate medical intervention can be provided to stabilize the patient's condition. Medical treatment for anorexia nervosa also involves nutritional counseling and therapy. Nutritional counseling helps patients restore a healthy relationship with food and develop balanced eating habits. Therapy, including cognitive behavioral therapy, CBT, addresses the underlying psychological factors contributing to the disorder, such as distorted body image and fear of weight gain. Supportive care from family, friends, and support groups is also a vital component of treatment. A strong support system can provide encouragement, understanding, and assistance throughout the recovery process. Now, let's discuss bulimia nervosa. One of the primary treatments for bulimia nervosa is therapy. Cognitive behavioral therapy, CBT, is particularly effective. CBT helps patients identify and change the negative thought patterns and behaviors associated with their eating disorder. It focuses on developing healthier coping mechanisms and improving self-esteem. Nutritional counseling is another crucial component of treatment. Registered dietitians work with patients to establish balanced eating habits, understand the importance of nutrition, and develop a healthier relationship with food. This step is vital for breaking the cycle of binging and purging. Medications can also be part of the treatment plan. Antidepressants, particularly selective serotonin reuptake inhibitors, SSRIs, have been shown to reduce binge eating and purging behaviors. These medications can also help address co-occurring conditions like depression and anxiety. Stress can impact our eating behaviors in profound ways. For individuals with bulimia nervosa, stress often leads to binge eating episodes as a way to cope with overwhelming emotions. This is followed by compensatory behaviors to try to counteract the binge eating. Managing stress effectively can help break this cycle. There are several effective stress management techniques that can support recovery from eating disorders. These include mindfulness and meditation, which help bring attention to the present moment and reduce anxiety. Practicing deep breathing exercises can also calm the mind and body during moments of high stress. Engaging in regular physical activity is another excellent way to manage stress. Exercise releases endorphins, which are natural mood lifters. However, it's important to approach physical activity in a healthy way and avoid excessive exercise, which can be a compensatory behavior in eating disorders. Establishing healthy daily routines can provide structure and reduce stress. This includes maintaining regular sleep patterns, eating balanced meals, and setting aside time for relaxation and hobbies. Consistency can create a sense of stability and control, which is beneficial for managing stress. Thank you for joining us in this important discussion about eating disorders. We hope this video has provided you with valuable insights into understanding and managing these conditions. Remember, eating disorders are serious but treatable conditions, and seeking help is the first step toward recovery. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more content on mental health and well-being. With the right support and treatment, recovery is possible. Stay healthy and take care.